Good afternoon, everybody. Christine Varconi here in the NBC4i Streaming Center with NBC4 data journalist Ben Orner, joining me now on this Thursday to talk about our 50 cases per 100,000 people tracker. And things are looking good, Ben. Things are trending downward right now. What's this week's number?
So as of yesterday, my tracker has us at 141,
Where's that
which,
graph?
that's almost 3 times as much as 50. But considering where we were, I mean, we were over 200 a few weeks ago. If you remember back when Governor DeWine announced the 50 goal in March, early March, we were trending way down, and then we bumped up and we were at 200. Now we're kind of back to where things were at their best during all this. So, and the decrease right now seems pretty consistent. So I'd expect it to continue to go down until I don't know whenever, but things are looking good.
Yeah, and we got a new set of numbers just a few minutes ago, and they were below 1,400, which should bring that down just a little bit more even.
Yeah, 1,387 new cases today. 1,387. This week has looked pretty good. We had 1,000, under 1,000 on Monday, which is pretty rare for a weekday.
Yes.
Just under 1,300 on Tuesday, just under 1,500 on Wednesday, and now under 1,400 today. Today's it's a Thursday. It's the fewest new cases we've seen on a Thursday since October 1st.
Wow.
Which is really impressive. Which means that if you think back, that sort of late September, early October was when that fall spike hadn't really hadn't seen its worst yet. It was just starting. So if we can continue this kind of deal, we're back in good territory. So it's reason to be optimistic right now.
Yeah, with that little roller coaster that we had been on,
Yeah.
it was hard to predict when we would get to 50, thinking sometime between April and summer. So potentially still on track to do that.
Yeah, I think Governor DeWine's original prediction, or just to give people some sort of date, was July 4th. So now that things are trending in the right direction, that certainly seems doable. There really isn't a great way to predict how things are going. We have a slower vaccination rate now, much slower than it was at their peak in March. I think we only had 20-some thousand new vaccinations, I think shots in total yesterday. So vaccinations are slowing down, which means that we're not getting as close to herd immunity, and the virus has more of a chance to keep cycling through people, which isn't great. But the more vaccinations we keep seeing, as Governor DeWine always says, we'll keep that number down.
Yeah, I'm just reading some of the comments here. People, nothing really much to add to the conversation, but Kathy's been very persistent with her comments, and she said that if everything's hunky-dory, why are you sitting in the same room? Ben and I are both actually fully vaccinated, and we are about 10 feet apart right now. So just a heads up for you there, Kathy. We appreciate your comments and you engaging on this post to get it more noticed by people who want to interact and see these numbers. Let's turn towards vaccines, Ben. I've got that map here up on the page right now for everybody. Let me see if they've updated this yet. Let me refresh, because these are based off of the FIST numbers. Still in the FIST, but I mean, one day doesn't really do too much for you. So was looking at the trends here a little bit earlier, and you can see that about 41% of the state has begun the vaccination or has completed the vaccination process with the J&J vaccine. What we're seeing now, just looking at these numbers, is that Ohio's most populated counties, Franklin County, Delaware County, Cuyahoga County, Medina County, up towards the Great Lakes, and then down in Cincinnati, you've got Warren County and Hamilton County. They're starting to surpass that statewide average by quite a bit. I mean, Franklin County is about 43, about 2 points above. We know Delaware County's been through
53% Delaware County. That's just crazy.
We've talked about Delaware County. So the secret sauce in Delaware County is the proximity to Franklin County, and it's also per capita the most educated county in the entire state, with people holding post-secondary degrees, bachelor's, and even the a huge amount of even graduate school and doctoral degrees. Anyway, and then what we're seeing here in our rural counties is they are falling way behind. So Tuscarawas County, only 30% vaccinated. Carroll County, 31. Harrison County, 30. Jefferson County, 33. Then down in the southern counties, Lawrence County, kind of even lower, 24% vaccinated. And that's just one dose, not completed. So these are the trends that we're starting to see, is that the more populated counties are kind of starting to exceed. You can see, this map where the darker colors are. You've got Toledo, Dayton, Cleveland, Cincinnati, and Columbus that are exceeding that statewide average right now.
Yeah, we'll have to hear more from health officials as they look at the data as well, and try to think of what's causing discrepancies and differences. The worry was, if you remember back when we started vaccinations, that marginalized populations, especially urban populations and folks of color, would be more hesitant to get the vaccine because of the history of medical abuse, and the state health officials really hit that hard, and those rates have gone up for folks of color. But right now, to me, it seems the biggest dividing line, I guess, between getting the vaccine, not getting the vaccine, education, and also with that partisan affiliation. Republicans and conservatives are much more unlikely to say that they are going to get the vaccine that they have or that they plan to. We haven't really heard the governor talk much at all about the partisan divide or any sort of education divide in getting vaccines. He's talked a lot about the racial discrepancies and such. But yeah, Christine, as you pointed out, I think that as more educated people, people who maybe you work in like an urban hospital or something like that, you just have more access to scientific and medical information, and people in cities are more liberal, and the polling shows that they tend to trust vaccines more. I think that the data right now is showing us that those differences are just going to keep getting bigger.
Yeah. Definitely something interesting. I know we could work on different stories and kind of make the data understandable in a I guess like a more not anecdotal type of way, but
one problem is that the state does a pretty good job of tracking vaccines in different demographics, ages, ethnicity, race, sex, all that, but they don't really track like education level stuff, like that's like way in the weeds kind of stuff. So right now, the state doesn't have, from what they release publicly, like hard data to back that up. But we do see a more widening divide than there used to be.
Yeah, certainly. Yeah. I think that's about all we have for today. Let's take one more look at the current trends page over on coronavirus.ohio.gov. This is the Ohio Department of Health page. Again, just a few minutes ago, 1,387 new cases, below the 21-day average, which is coming down to about 1,500 at this point. Yeah. Hospitalizations, 127. That is above the 21-day average of 118 per 24 hours, and then 24-hour reported ICU admissions is 15, which is right out the 21-day average of 14. I talked to Ohio Department of Health's infectious disease doctor Gastaldo the other day, Ben, and he told me that the people that they have hospitalized at Ohio Health in their health system, which is a huge health system that spans many counties, none of them were vaccinated. So everybody that they have that is in the hospital right now, they are unvaccinated people. So he is seeing people who are vaccinated, if they do get COVID, which is the very rare, but has happened, they're not being hospitalized for it. So
yeah, it is really rare. You get the first shot and that doesn't kick in for a couple weeks. So, there are rare cases of people getting COVID during that time. But yeah, I mean, your best protection against coronavirus is the vaccine. Some of those have 95% efficiency rates. It's just, people have described it as a miracle that we've had it, and it's pretty outstanding that we're able to get inoculated against a disease that we only knew existed just more than a year ago. So that's, vaccine is your best protection against coronavirus, and it's something we hear the governor say every week when he speaks, is that if you want to see the number go down, the 50 per 100K number go down, get vaccinated. We're only at 40% of people having their first shot. Herd immunity, something like, I've heard between 60 and 90% of the entire population for herd immunity. So we're a long way off of herd immunity, but we talk about how the numbers are down, they keep going down. There's a lot of improvement with the rate. We have to see to get to 50, and for health orders to lift, and we to stop wearing the masks, and we can be closer together, that kind of stuff. We need to see 417 cases a day, and we're at 1,400.
Yeah,
so
we're still a long way off.
We're improving greatly from where we were, but we're still not very close to where we need to be. And the best way to get to where we need to be, as health officials will tell you repeatedly, is to get vaccinated. They're accessible. There's it used to be that you couldn't get an appointment. They're very accessible now. That's the silver bullet for this thing. So Christine and I are both vaccinated. It's fine, just a shot.
It's a nice peace of mind, that's for sure.
Yeah, it's great.
All right, Ben, thank you very much. Appreciate you being here. Let me move this camera for people so they can see like kind of the setup.
Oh yeah.
Yeah, so I mentioned that Ben was 10 feet away. He's 10 feet away just because that's how this set is set up.
Mask. And both have masks. And the newsroom policy is
we're good,
wearing masks all the time except when you're on air, so you can see our beautiful faces. So,
all right. Appreciate all the comments and attention this video has gotten. Hope you guys got something out of it, and we will see you next time.